We now go above and beyond the headlines with Health Undersecretary Rosario Vergeire. Ma'am, good evening and welcome to Newsnight.
Good evening, ma'am.
Yes, ma'am, let's begin with this. Let's talk about the proposal to have these COVID home care packages. Can we go through the list? No? What is going to be included po dito sa mga home care packages?
Yes, ma'am. The proposal would be that there would be this preventive equipment, like we will have the mask, we will have disinfecting materials or chemicals, and then we will also have instructionals or plans that families can use, like, for example, instructions on how to use the medications, instructions on how they can monitor themselves, instructions on when they should be going to the hospitals already. So aside from that, also we would be including. Yes.
Sige, go ahead po, ma'am. You will also be including
yes,
what po?
Yes, we will be including common medications for fever, antibiotics, and the others.
Ma'am, what about a pulse oximeter, for example, oxygen tank, for example, no? Just in case from a mild it becomes medyo severe, no? At hindi makapunta ng ospital. Because some doctors, maraming umiikot kasi na balita, no, na these are some of the instruments, the equipment na pwedeng gamitin sa bahay para nga ma-monitor ng pasyente ang sarili niya.
Yes, ma'am. That's part of what we are trying to look at and negotiate, if we can have pulse oximeters so that they can monitor their oxygen saturations at home. We also are including thermometers, and if the budget would still suffice, we can include blood pressure equipment. But for oxygen tanks, I don't know if this would be feasible because we are not really encouraging our kababayans na they will use oxygen on their own at home.
I see. Pero ang problema po kasi naman talaga po, ma'am, is that we have a problem, there's have been, countless of stories of people who cannot get into hospitals and need to have oxygen and do have oxygen tanks at home, no? So, some people are, maybe desperate already na kailangan may oxygen tank sa bahay. So, is that something that could be possible? After all, if there is medical teleconsultation at meron namang guidance ng doktor at hindi rin makapasok ng ospital dahil nga puno or napakahaba ng pila para makapasok, maybe that could be something that you could consider. At the same time, I also wanted to ask about antibiotics. There were some questions kasi about whether dapat bang i-include ang antibiotics o hindi.
Yes, ma'am. If properly guided by doctors, especially that this home care package, we are trying to package this as one comprehensive process whereby, aside from the home care package or the kit, we are going to have the transport system, the referral system, and the navigation system alongside with this. So if we are going to have these telemedicine providers and to guide our constituents or individuals who's going to be accessing this home care package, antibiotics and also oxygen supply can also be provided in this home care package.
Yusek Vergeire, this is a little bit on hindsight, no? But given that we saw a trend, no, na pataas nga yung mga kaso over the last few weeks, is this something that we could have thought of about a month or 2 months ago, itong mga home care packages? Because if we had looked at the numbers, the occupancy rate ng mga ospital, then we would have seen na medyo nasa 75-80% halimbawa. Is this something that the government, the health department could have considered earlier on, much earlier on?
Actually, ma'am, this has been recommended already and instructed that DOH drafts the guidelines for this about 2 weeks ago because of this kind of situation. And we had been, of course, we had been trying to draft the guidelines and also negotiating with PhilHealth so that it can have a financing mechanism. But as to the previous times, if we are going to recommend this, we have to understand also that the COVID-19 disease is quite uncertain. No? Like, for example, the status of a patient can change from mild to severe in a couple of hours. So this kind of situation would warrant that patients are immediately brought to the facility. And we were relying on the telemedicine platforms that we were providing as part of the support for people who are staying at home. But yes, this home care package is now needed, and I think the guidelines, if it will finalize, will provide needed support to our citizens.
Well, it's good to know that there will be financial support from PhilHealth for that, ma'am. On another issue, we're at 1 million plus cases already. We are approaching April 30. I understand the DOH, and correct me if I'm wrong, would rather retain the MECQ status for the NCR plus bubble. We've seen from 15,000 halimbawa April 2, nasa 8, 9,000 tayo. No? Pero hindi pa rin yan, that's not something that can make us feel that is something that we should not be complacent about. Is that correct, ma'am? And you do believe that we should retain MECQ for at least 2 weeks?
Well, definitely, ma'am. This is not something that we should be complacent about because, as I have explained a while ago in my media forum, that even though that there is this decline in the number of cases, the average, the 7-day moving average, we can still see average daily attack rates, which are still very high across the different local governments in Metro Manila and other areas of the country. So our position, of course, DOH as the health agency would prefer that we will have still this restriction, no MECQ. But of course, when we look at the complete picture, we need to also balance health with economy because economy also impacts to health. So it will be decided on tomorrow in the IATF, and there would be specific compromises that will be undertaken so that we can be able to have a collegial decision.
And ma'am, pahabol na lang po na tanong, medyo naghabol din po tayo sa vaccination. No? Dr. John Wong was saying that we should have about 350,000 vaccinations every single day if we want to get to that goal of herd immunity. Are we going to be able to do that, ma'am? And you don't have to discuss the schedules of the arrivals of the vaccinations. Pero, is there hope on the horizon? Are we going to see more people vaccinated in the next month, May, June, July, August?
Well, ma'am, if we talk about the numbers that is being estimated per day so that we can achieve the 70% of the population, for now, I can honestly say it is still not possible, no, based on the supplies. We all know that there is this global shortage or there is this competition across the globe when it comes to vaccines. But if we are going to say if we can speed up and scale up in the next coming months, yes, I can say that because there would be vaccines that are forthcoming in this coming month, although it is not going to be sufficient for us to say that we'll reach herd immunity in 2 or 3 months. But we can already cover the other classification or priorities of government like A4 and A5.
Okay, so in other words, ma'am, what we need to do is hopefully remove those bottlenecks in the global supply shortage. Sana ma-resolve na yan agad-agad. No one is safe, ma'am, hindi po ba, no? Until everyone is safe. You said Rosario Vergeire of the Health Department. Ma'am, thank you very much for joining us this evening.